Hello and welcome to your daily dose of Dr. Fern, where you medicine woman, you learn how to practice your passion. So cancellations, they are a nightmare. They can be a nightmare. And I remember when I first purchased my practice from the retiring 70-year-old male dentist, there was no protocol. Patients were just cancelling left, right and centre, and sometimes it would just leave huge gaps in the day and there'd be people on priority that we couldn't get hold of. And we all know how crazy it can be when patients just cancel on you. You know, suddenly a day just turns to, a filled day would just turn to one or two scattered appointments. And that is not good for you, not good for business. So what do I do with cancellations? Well, what I started to do was create a system and a protocol for all the staff to follow with cancellations. And there is a cancellation policy at my clinic. Now, I have to tell you that the aim of the cancellation policy is not to penalize the patients, but it is to teach the patients to value our time. And as a result of that, we must live with integrity and we must also value the patient's time as well. So what do I do with the cancellation policy? Well, it starts from framing it right at the start on that first initial phone call when the patients book in. The staff are all trained to make sure that they tell the patient that there is a cancellation policy. So cancelling for me outside of 48 hours is fine, but within 48 hours, it might incur a cancellation fee. Now that is pre-framed right on that first phone call, so the patients expect it. It is followed up by an email. Everything that we email patients, there is also always a cancellation policy at the bottom, so patients can note that. Now, what happens is that we give the patients lots and lots of chances of confirmation and notice. But of course, when the staff ring up the patient, depending on how far the appointment is, the staff ring up and they never say, "I'm ringing to confirm your appointment." The staff will always call and say, "Hi, Mrs. Jones, I'm just ringing to make sure that before your appointment with us, you know where the parking is, especially if they're a new patient, you know where we're located, have you had your OPG done, etc., etc. And we'll look forward to seeing you tomorrow or the next day, whenever it is." So that's really good to just keep giving the patient lots of value, but also tagging alongside that cancellation policy at the end. So Mrs. Jones, and if you do need to reschedule your appointment, we do ask for more than 48 hours notice because we have a huge priority list. So pre-framing it, setting up the tone, and then of course, sometimes the patient will need to cancel. You know, we're never going to be immune to that. But initially when everyone rings up, and there is something going on, initially we always ask, "Look, Mrs. Jones, is there no way you can make this appointment?" Because usually there is a cancellation fee involved. And we wait. And I have to say about 50% of the patients then will say, "Hey, listen, I'll keep that appointment," because maybe it was just a lunch that they had to move or something easy, right? But once again, you are just reiterating the importance of our time to our patients. And then after that, if the patient is needing to cancel or reschedule, what we do is, well, we empathize with the patient. We're going to get our front desk person to not penalize this patient, to let them know that we are on their side. And if they rebook, just say usually there's a deposit that gets applied, and instead of charging you the cancellation policy, because we can see you've been a fantastic patient, what we'll do is we will just put that through as a deposit. And you will get patients, most of them, who say, "Okay, that's fantastic." So it is all in the wording and how much value you have given this patient. If the patient gets really offended and something blows up for whatever reason, maybe 1% of them do, then we always pull back and we say, "Okay, how could we have communicated better? How could we have communicated better so that we get a better outcome from that patient?" But if they do refuse to pay, and you always get that 0.5% who do, at least now you have trained them to respect our time, so that the serial cancellers, we actually then take them off their books, and they know that. And so it's been really interesting seeing the transition of my clinic from patients who just used to cancel every day, anytime they wanted, to patients ringing up now and saying, "I'm so sorry, I have to reschedule this. I know it's out of the cancellation time, and please, here's my credit card." And of course, we don't take that. It is just amazing to see that you are just training your patients for time, right? To respect your time. And like I said before, they are respecting your time, then of course you have to respect theirs. And for us, if we're doing late short notice cancellations, generally we give something back to the patient of some sort to show them that we are respecting their time as well. So if you like what you hear, please share this with your friends on Facebook, social media, and remember, keep laughing out loud. It is the second best thing that you can do with your mouth.